All right. Good morning, everyone. My name is Dr. Tashina Reeder, and I am excited that you've decided to join us today for our presentation. Welcome, welcome, welcome. Before we get started, I would like to provide you with some housekeeping notes, if you will. The chat box has been disabled, but you can ask all of your questions in our Q&A box below. So feel free to chime in the Q&A section. At the end of the presentation, do not log off. You will be prompted to complete a survey, right? We want to hear from you. We want to hear about all of the things you've learned today and that you would like to share about what you learned in this session. And so at the end of the session, we will also answer your questions if you have questions that you've posted, okay? So without further ado, I'm going to hand over today's presentation to Paul Iarrobino.
Thank you so much, Dr. Reeder, and thanks for your patience. It's 8:30 my time, 11:30 your time, and I think this is the earliest presentation I've done, and I appreciate your patience with me and Zoom. I'm going to share my screen effortlessly here, and I'm going to press the right button this morning, and we're going to get started. Hopefully everybody can see this. I hope so. Oops, all right. Gonna go back here. So can you all see this? Can someone say yes or no? Because I'm a newbie at this. I see something in the Q&A box. Let's see. We can see it. Yay, thank you. Great. Well, good morning. And the first hurdle is accomplished. I'm over the first hurdle. Thank you. So just a brief introduction to my background and context today and where we're going to go with this presentation this morning. And I'm hoping that we can have a dialogue about some of the lessons that we're learning about the pandemic and how it's impacted us. So first off, when we think back to the pandemic, the early stages of it, I can just speak for myself. It was just ultimate chaos and fear because everything was changing. And as someone who's self-employed, it meant that all of my work was gone. It was canceled. It was just like everything off my calendar. And then all of the volunteer stuff I do in the community also canceled. And it was very hard for me to adjust to that because a lot of the things I do in the community bring me validation and also just help recharge me, and that all went away. And then to make things more complicated, last March, I didn't know this at the time, but I got COVID-19. I was very sick for 2 weeks, and I didn't know that I had COVID-19 at the time, and I thought it was the flu. And I was very, very ill and really depressed because I didn't have a lot of energy. I didn't know what I had. I figured it was the flu. And meanwhile, my husband, who is much more introverted, very quickly adjusted. And so he now, who's an engineer, he's home, he's working from home, and he loves that. He doesn't want to go back to work. He still doesn't want to go back to work in the setting. And so I hear him on these conference calls, and he was like talking to colleagues, and I was like, oh, what about me? What's my purpose? What am I going to do? So that just gives you a little backdrop to where I was a little over a year ago and kind of what's been happening since then with me, and also how I've been able to redirect some of that energy. And I'm going to advance a slide here. Uh-oh. There we go. So all that to say that with my experience with COVID, everything I'm about to tell you today is completely unplanned. So I'm going to talk to you about these groups that I've started. I have different cohorts, and in putting together this presentation, I've realized that we've done over 100 of these conversations, weekly conversations, where we're getting into a lot of depth. So the immediately after getting sick and feeling better, I reached out to a local senior center, Hollywood Senior Center. This is Portland, Oregon, not Hollywood, not West Hollywood, but a neighborhood here in Portland called Hollywood. And I've been doing a lot of volunteer work with them. And again, I was like, hey, I hear there's something called Zoom. Maybe I could offer like a workshop or something. And they're like, okay. So I got a Zoom account. This is the same Zoom account. And I said, let me just see if I could reach out to folks. And what I found then was there was just a lot of ambiguity about where we were going. And just like my experience, many older adults were just having big problems because their lives went away. The senior center was a hub of activity. Many people were volunteering that, and it was a sense of community where there was just really no notice, shuts down. And that's not to say it wasn't warranted, but that was the safety net for many people in the community. So I offered it one time, and all of a sudden it was a hit, and people were like, when are we going to do it again? And I was like, maybe next Tuesday. So I kept doing that weekly for many, many weeks. And then after several months, we changed that to twice monthly because the senior center now is offering so many rich programs that they didn't have before. I mean, they had some things, but they were bringing everything online, like Zumba. They were doing a lot of stuff around like Black Lives Matter and bringing in poets and authors and just a lot of rich programming that was coming on Zoom. And so I thought, let me just do this twice a month. And now this group functions as a drop-in. And people like to have topics, so the group decides what topics they'd like to discuss. And that's what we've been doing. And I'm going to also tell you about some of the other cohorts that we're doing. And so another group that we started, and this is a mixed cohort. It started off where I was doing some outreach with LGBTQ programming with the Unitarian Universalist Church in downtown Portland. And they had asked me if I could help with their faith community. So I did that, and it's a mixture of LGBTQ older adults and faith people. So pretty much all the faith people are folks who are not LGBTQ, but just through my own outreach and networking, we have LGBTQ. So it's like half and half. And what I found with this group is that they were much more familiar with technology, way more than I was familiar with technology at the time, still way more familiar with technology. And they were telling me like, okay, you should ask people to mute themselves and you should try this. And this group also has weekly topics as well. And a lot of this focuses around their experiences with the pandemic and having people they can talk to. What about people with HIV and AIDS? And so while those first two that I mentioned were volunteer experiences that I'm still doing, I have a contract with the state of Oregon, and there's a program called End HIV Oregon. And as a performance artist, as a storyteller, I had already been doing work in this community for the past 3 years and putting together events. And really, a lot of that is focusing on how do we reduce stigma and isolation with long-term survivors of HIV. So, of course, my contracts with the state of Oregon, Oregon Health Authority, the same people who are making sure that we're safe with COVID, and they said to me, okay, your contract's starting April, what's your COVID plan? I didn't have one because what I submitted was all the stuff I had done before in terms of bringing people together in community. So I said, well, I'm doing this with older adults, and many of these folks who are long-term survivors are older adults. So let's try that. And that's what we did. So starting last April, right around the same time, I was offering one cohort a week. And then come July, I was realizing that there was so much more need for this. And so I expanded outreach to include rural Oregon and also to do more outreach to women. So the group started off as all men, and initially, and then we morphed into including suburban, rural communities around Oregon, many of them very, very isolated. And I'm finding that the average age is mid-50s. for our group. The oldest, I believe, is 74. The youngest, I think, is in his 40s. And also because it's a contract I have with the state, I like to report outcomes, and I'll be telling you about some of the findings that we've discovered along our way. Here's a big piece that I want to talk about today. And when I first started this, I was really concerned about people who don't have access to technology, and either because of experience, not having maybe a lot of experience with computers, or just the financial barriers. And so early in the pandemic, I reached out to Metropolitan Family Services. I'm a volunteer driver with them. And I just sat down with the executive director through Zoom, and I just begged her to put in for a grant. Because I was saying to her that there are so many barriers and many people are not able to access these. Some people are coming in through the phone, and it didn't feel authentic to them because everybody else could see each other and they were missing out. So I sent her some talking points saying, if anybody in Portland, Oregon can figure this out, you can. You've got wonderful grant writers and you're so respected in the community. And so I just sort of like dropped it at her door like last April or May, and I didn't hear anything. And finally I got a call late fall, October, I think. And she said, guess what? We got a grant from OHA, Oregon Health Authority, and they put in for a larger grant, which was around food insecurity and housing and all of that related to the pandemic. There were some federal funds available, and they put a small amount in. They put in $52,000 to start up a program. And if any of you have experience with grants, sometimes it's like hurry up and wait, and all of a sudden like, okay, you have the money and now you have to hurry up and spend it. So the challenging part was we got the funding and it started in November, and we had until December 31st to make all this happen. And I'm from the East Coast, I'll tell you, I can implement. So it was like, oh my goodness. And the other thing is I also realized that Hollywood Senior Center, which I do a lot of consulting work and volunteer work, they had recently done a survey, and they were discovering what some of the unmet needs were, and technology was something that really came up quite a bit. So we already had people that we could outreach to, which was phenomenal. So this was a new funding source, and we had to spend it fast, and I'll be telling you about that. So I'm just going to talk about this briefly. My experience with my practice with storytelling, and what the literature says is that storytelling has been viewed as a healing practice, especially for older adults with resilience. And that's been documented pre-COVID anyway. And same here, when I do events, it's usually, do it for a couple of weeks or 4 weeks. We have maybe a topical thing. We bring people together. I've done a lot for LGBTQ older adults. And a lot of it is just being able to, connect with our stories, connect with our history, and be able to have a storytelling event. It's very cathartic, and it brings people together and establishes friendship, and establishes community. It breaks down barriers. So all that has been proven. And there's this term called narrative foreclosure. And Mark Freeman, who's a very well-known gerontologist, really calls this sort of stagnation. When we get older, oftentimes we don't really feel that we have a lot to contribute. And part of it is cultural in our society, because we're not really actively engaging. We're an ageist culture. We don't often ask older people what's important to them. And also, too, we have these old tapes. And that's something I talk about in my storytelling practice all the time. And so sometimes it's important to look at some of our old tapes, because some of those old tapes, they're there maybe to protect us and to help us through, but they're not always true, because maybe we have grown since then. And so it's a way to address some of those issues. And so with my practice during the pandemic, what I decided to do is be very intentional about having something that we could focus around. And so for the very first cohort, and all the ones I've built since then, we're focusing on these 3 words: gratitude, resilience, and connection. These are kind of the principles. And what I learned early on is that if we didn't have sort of like these principles in place or a lens in which we see the world, we could very quickly move into the pity party because all of us, many of us, were experiencing problems like, well, why aren't they wearing a mask? Or when are they going to come out with a vaccination? Or now they have a vaccination, but why do older people have to go online to access it? And there was just a lot of frustration, right? Or, I'm older and they have special hours, but like the younger people are going. And it just was just really hard to manage. So we really focus on gratitude, resilience, and connection as a way of what are some of the things that we are doing? How are we empowering ourselves? And we also use storytelling techniques to sort of guide the discussion. Why do you think that is for you? So really approaching things from curiosity and not judgment. And then people share at their own level of comfort. And that's important because sometimes people have bad weeks and it's more helpful for them to maybe to listen and to connect. And what we're seeing is a lot of positive, lasting results because now this has been going on for well over a year, and I'll share some of those with you in this presentation. So now I'm going to kind of walk through some of the group considerations, and I'll be curious if this resonates with any of you when we have Q&A. So my experience is that each group is unique, even if it's a similar demographic, each cluster of people is unique. And I didn't have ground rules on the very first one. I didn't think of having ground rules, but I've added those since then. And I've also realized that ground rules need to adapt and change over time. So the ground rules themselves need to be flexible because if they're not, sometimes that prevents us from growing as a group. We have a trusted space that we have every week, and people really respect the boundaries that we have. We have a role of the facilitator. So I facilitate all the groups, and the role of participants. And really to say that I don't have any special role as a facilitator other than to sort of guide the conversation, maybe to help people expand a little bit on their thought, make sure that people who haven't been speaking have a chance to speak, just the general rules of a facilitator, and to make sure that I'm really trying to capture what's happening and to maybe feed some of that back. What I think I'm hearing is XYZ. Is that true? And oftentimes it's like the only place that people could come or do come to talk about their honest feelings. I find that 6 to 8 people is ideal, and 60 minutes is the sweet spot. About an hour is perfect. Sometimes if we have a heavy topic or a topic that we think is going to be, it's going to bring up a lot of issues for us, we might make that 90 minutes to give ourselves more time. Group ownership. One of the interesting things that has come up for every single group, and again, I'll say that I'm not an agency. I'm not sort of a standard nonprofit agency, HIPAA, all that. I'm a storyteller. I come under the more of the performance arts arena, but I also believe in confidentiality, and I believe in many of those same principles. So what comes up every time is, can we share contact information? And so I asked the group, and in every situation we've had so far, the group has said yes. And so that's been helpful because some friendships have been developing outside of the group. I'm also saying that this is more of a sacred space. If you asked me 7 or 8 months ago, I would say it's a safe space, but I really feel like now that we have this time under our belt, the space is sacred, and people really, really are doing everything they can to respect the space. And the folks who kind of come through this long term, that's really important to them. I also say this in my storytelling practice. This is not therapy. It's therapeutic, right? It's a very cathartic opportunity to exchange ideas and talk about things that are important. But at the end of the day, I'm not a therapist. I don't pretend to be one. And I'm not out there saying this is therapy. It's not a group support like maybe a group that's led by a licensed counselor. Definitely a strong group commitment, and the conversations have that each group has created have been unique, and there's definitely been some trends, and I'll share with you some of those as we get through this presentation. The other thing is the adaptability of this model. So there's a lot of different variations that the groups can take, And again, I'm just following the lead of what seems to be organic with each group. I mentioned earlier that while it wasn't set up as a drop-in model, the Hollywood Senior Center is now a drop-in. And since all the groups are full, new people can come to that. I refer them to the Tuesday group at the Hollywood Senior Center. That's twice a month. And it's a good opportunity for people just to kind of connect and see if it's a good option for them. And also, since it's topic-based and it's in the Senior Center newsletter, people might just come based on the topic. The HIV group, this is something that started from the very beginning. I don't do it for any others, but there is a strong interest in having conversation, casual chat that's not related to the weekly topic. So I open the virtual doors 15 minutes early, and people come, and it's more like a coffee clutch, and we just hang out. And then when 10 o'clock comes, then we have the full hour together. So that seems to work really well for that group. And it's kind of fun because sometimes we play a little game like, who do you think is going to come in next? And we make it like a little game show thing. So that's just a really, really fun way just to connect people offline before we get into more of a formal topic. The groups, all of them have pre-selected topics, and they can think about that. They often think about that during the week, and then they come in and they chat about it. The HIV group and the mixed cohort, that's the Wednesday group, they often like homework assignments. And so that typically would be sort of like an article that someone's bringing forward. They'd like someone to read an article. Since I produced many storytelling events, especially for long-term survivors, they might say something might come up like survivor guilt or, resilience. And I said, well, I did a thing and we have a 9-minute story. Do you all want to talk, review that and talk about it? And they like that. And that's been something that we do there. Interestingly enough, and I'll be curious to get your reaction for this, the HIV group as part of the ground rules, very beginning, there was strong discussion about paid staff and no paid staff involved. And that came up as because many of the people in the HIV group were already part of different HIV specific groups through agencies. And what I was hearing is that they just wanted a place to come where there weren't case managers. There wouldn't, it wouldn't interfere with maybe their case plan, if you will. And so, and I've respected that from the very beginning. And I've said no probably 7 or 8 times to agency staff. It was hard for me to do that, but it's also out of respect for that ground rule. I also had a person who is HIV positive who works for an agency and said, but I'm HIV positive. And I said, I know, but this is what I'm hearing, no paid staff. No paid staff? No paid staff. So, and I've heard several times within the group how that has been helpful for them to really express things that they would probably not say in another group. So there's that. We also have ad hoc topical discussions. As I mentioned earlier, sometimes the groups have these themes that come up independent of each other. And so what I've done is I've kind of packaged those and I'll do them as a separate topic. So each group, for example, there's been several topics that have come up with the groups. One of them, the most recent, is this thing about decluttering, because we're in our homes so much. So in one way or another, this idea of decluttering or reorganizing or, reevaluating our space so that we have more room. Like this used to be my closet. It's a small room and it was really junky. Well, now it's my Zoom room. I don't do anything in this room but have Zoom calls. So that was something that came up. So what I've done is I've created, just for the community, I've also done this with libraries and have these conversations. So the last one I did was on decluttering, and we had 21 people attend. And these are mostly people who are not part of these groups, but also we've had a few that come in plus general community. So it's been really helpful to stay on top of like what people are bringing up. Here's some takeaways. I often find that we find our strength through our vulnerability. And I find that people who can be vulnerable often show the most success, right? And when I say success, I mean success to them in terms of If they were feeling isolated before, they're not feeling isolated right now because they're doing some things that are helping them get out of isolation. Or if they were depressed or whatever it is, it's that vulnerability piece. And I find that when we're vulnerable with each other, then it gives all of us permission to sort of, dig deep if we need to. The other thing about this is the traditional boundaries don't exist anymore. And that's been really, really helpful. I think the urban rural has been probably the biggest thing that I've found. I have some participants in both rural Oregon and rural Washington, for example, and their experience is very different. And especially for people who are HIV positive or have AIDS, many folks don't have the community connections. They don't have the healthcare access. They don't have the case management. There is definitely many things that are lacking, and often don't feel comfortable having conversations about their status. And so that has been hugely helpful. I also find that without these traditional boundaries, like you have to live in this zip code or you have to be in a certain, I feel like things have really opened up. Like it doesn't matter. Like these groups are free, and it doesn't matter your income. It doesn't matter this. It's just like if you think you could benefit, come. And many of the referrals, especially in the HIV groups, are coming from people who are already benefiting from the group. So that word of mouth is really important. And I just like not having these traditional boundaries. Definitely, many new friendships have been established and nurtured. And at the end, I'm going to show you some examples of that. Oh my goodness, what's this, Paul? This is a Wordle, and this is part of where I'm going to go now with the evaluation. So I've done both qualitative and quantitative surveys with all of the cohorts. And what you're seeing right now are the words that people have used in the narrative piece. So each person was asked, would you refer this to a friend? Why or why not? What's your overall level of satisfaction? Why do you say that? So these words connect with what people said independent of each other. It just basically got thrown into a computer program. And you'll see the big words like connection, pandemic, gratitude, others, people. Those are the words that came up a lot. But what I always find interesting about this is that there's words that I don't particularly use, but people in the groups do. For example, geezer Zoom group. The Wednesday people call it that. I've never called it that. That's not part of my vernacular, but it's how they call it. They're like, this is I gotta go. I've got my geezer Zoom group. All right. Or Zoomer friend. These are my Zoomer friends. Great, So, but you can see what people are saying in terms of, like, if you look around, feeling of isolation, diverse backgrounds, comfortable judgment, must be comfortable, I don't know, negative energy. So probably people talking about just how there's so much negative energy out there, safe space, safety measures, intimate life details. So anyway, this is what people are saying. And I always just like to look at this to remind myself of how people define their experience in their own words. Now we're going to look at some of the data. So while the N is very small, 9 people responded to the survey. 8 out of 9 people said they were very satisfied, and 1 person said somewhat satisfied. So basically, 9 out of 9 people were either somewhat or very satisfied. I wish the numbers were larger. Not everybody completes these online surveys, but that's what we have. And similarly, would you recommend it to a friend? The same breakdown there. 8 very likely and 1 somewhat likely. Now look at this. Does this reduce stigma and isolation? And overwhelmingly, all the participants said yes. And that makes me very happy. And I see that week after week in how people are presenting themselves. And I did my best to try to break these into areas that made sense, but there's definitely a lot of overlap. So one area that I find it's been helpful is socialization needs, especially during COVID. And the second one I always find interesting. I don't do support groups, and this is why I like this. And this is I've heard this come up, and so I'm assuming it's the person in the HIV group who will occasionally say why he likes the group, and he doesn't participate in any of the agency support groups because he's just not a support group kind of guy. But he doesn't see this as a support group in that traditional way. And also one person who's been really vocal about not having agency staff. So whatever works, right? Managing depression and isolation. I mean, if we even just ask ourselves, have we struggled with depression and isolation over the pandemic? And I did a poll, and if we were being honest, I think it would be pretty close to 100% if it wasn't 100%, because there's so much happening, right? And so this has been a very, very useful tool and a healthy outlet for people to connect, and especially when we're not leaving our homes. The third bullet down, to have a conversation with people who share my experiences reduces internal stigma and reduces my isolation, right? So again, I didn't really know. I only had maybe a month in when I presented this, but I can definitely say this has been really, really helpful. I'm now going to talk about 3 people from the different groups, and to give you a sense of some of the changes that people have experienced. This is where I'm sort of like a storyteller, but I believe since I can't use video because it doesn't work well and these kind of things, I'm going to just see if I can give you a sense of each person. So Jim is a long-term survivor. He's very involved with our HIV groups, and I'm calling him the accidental baker, homeless activist, and dessert missionary. So the story goes like this. Last Christmas, Jim, who's I want to say is a father and a grandfather, and has 2 dogs, and he really likes to cook and bake. And last Christmas, he agreed to go for a walk with a friend of his on Christmas Day. And the friend that he goes with has a lot of problem with isolation, depression, and they've been able to support each other. However, I don't know if you've ever experienced being overcommitted. Sometimes we say, oh, that sounds great. And then all of a sudden the day comes. Jim was not feeling it. Jim really didn't want to go on a walk. He had lots that he was cooking and preparing for a family meal, but he honored his commitment and he went with his friend Jason for a walk to the river. This is in Clackamas, Oregon. If anybody's familiar with Oregon, it's a lot more rural. It's close to Portland, but it's fairly rural. During that walk, they are walking through a homeless camp. This is Christmas Day, and a homeless gentleman was making Christmas dinner over an open fire. I don't know what he was making. And the gentleman offered Jim and his friend Jason food and said, would you like to have, something to eat? And Jim was being really honest when he was telling this shortly after it happened. It made him very uncomfortable, and he avoided eye contact like he usually does with homeless, and is just felt uncomfortable and is moving to the river where they were going on their walk, and Jason's following. And when he came back to the group, he said that made him feel really uncomfortable. And he said that when he came home, he realized he had a house and had heat and a roof over his head and a family that loves him and these 2 dogs that adore him. And he didn't like his behavior and had a lot of sorrow about that. But this is the place where people can come and talk about their feelings. And then not long after that, Jim said, I'm going to do something about that. And he is known for his baking. And he said, I am going to start a homeless ministry, dessert ministry, because this is something he can do to give back. And I'm going to show you his packaging. And each person gets this amazing dessert. And he's got a lot of street cred now in Milwaukee, Oregon. And every Saturday, there's a place where I think a church or a nonprofit sets up things, and they have showers and they pass out food. And people are always asking what he's got. And he makes a point of handing the dessert and looking the person in the eye when he gives them the dessert. It's very important to him. And some people in the group are saying, well, why don't you just pass out Twinkies or something? And he's like, no, you're missing the point. It's so easy to feel invisible. It's so easy to feel overlooked. That's how I've been feeling for so long. Being a long-term survivor, he's just really isolated himself. And he's like, I just want to make sure that people know that someone out there cares for them, and I'm not going to avoid eye contact. So here's what Jim is saying as a long-term survivor, surviving a plague and living with the consequences of that. I am striving to build community, end isolation, and empower long-term survivors to find ways of giving back and feeling pride and contributing to our greater community. So I think that is an example of someone who comes week after week after week and allows himself to be vulnerable, like we all do in the group, and realize that through gratitude, resilience, and connection, what are some things that I can do to do things differently? So anyway, that's Jim's story. And now I'm going to move over to Bobby. Bobby's part of our Wednesday group. That's the mixed cohort. It's got like half and half LGBTQ and half non. And she moved here at the height of the pandemic. And so anyway, but she says, I moved to Portland not knowing anyone but my daughters and their spouses. It was March 19th, 2020. It's probably actually right when I was deathly ill, right? And Portland had just gone into lockdown. As an older adult, I wasn't sure how this was going to work out for me. I not only was isolated, I was so lonely. I connected with Paul's gratitude and resilience during COVID group, and it was a lifeline. That was 10 months ago, and we will still meet, and we still meet weekly. Spring is here, and it's blooming all over. And here's someone who taught us about this term called forest bathing, which I'll get to in a minute. And then our final piece here is on Marilyn. Marilyn is transgendered, and prior to the pandemic, I used to work in the field of aging. And Marilyn was part of my very first storytelling event in the lower left. When I worked for the area agency in aging, I was doing a lot of work with older adults, especially LGBTQ older adults. And this is very early in her journey as being transgendered. And I've learned so much from her. And if you look at the lower right, I speak annually at the OSU Gerontology Conference, and this was the first time that we had LGBTQ on the agenda. It's never been done before. And she did a session with me on trans elders, and it was hugely successful because people just don't have this level of awareness. And in the upper right, that was something we did for National Coming Out Day. That was probably about 3 years ago. And then on the upper right, I produced a documentary called Breaking the Silence about LGBTQ veterans. And Marilyn was helping to pass out flyers at the opening at the Hollywood Theater. That's actually, she's right by the Hollywood Theater. So someone that I've known really well over the years. And Marilyn says, with our morning Zoom group, I feel safe, supported, not judged for me. And that is what's most important. I find this resilience, gratitude, and connection group to be the one I am most delighted I joined and prefer to participate with. So keep in mind that Marilyn is part of several Zoom groups, and some are trans specific. And it's this group that really resonates with her. And I think it's because of the depth of sharing that we get into and the interactions that we have. Okay, so I mentioned forest bathing. This is a term that Bobby brought to us, and it's something that outside of the group, several people every Thursday go for walks at Mount Tabor, which is a beautiful, beautiful park in the city, and they call themselves the Resilient Walkers. That came out of forest bathing, which some people started just doing some things around the state. And we have these safely distanced meetups. So what you see here is Holly, who's a member of the group, and she's also a classically trained violinist. And we're at the home of Gilda, and she opened her home to us. This was last June. And I want to tell you that last Wednesday, we had our reunion, and it was fantastic. And the one person who lives in a rural community drove up 7 hours and stayed with me for 2 nights. And he got to participate with the group. And it was the first time he met 3 of the members of the group in person. So this was last year. We did it again just recently. And this group is just, they're on fire. They just are so wonderful. I can't even tell you, I just get kind of teary thinking about how they're connecting. I'm going to talk to you about Detlef for a second. And I also want to say that I have permission to share all of these stories with you. And I have a wonderful audio that goes with this, but I don't want to ruin and blow up Zoom this morning with all of you. So Detlef lives in very rural Oregon. He lives in Klamath Falls, Oregon. If you're following the news right now, there's a national, it's national, where there's an issue around water rights. And it's getting very, very ugly right now between the farmers and the natives. And there's just not a lot of water there. They're in a drought, and it's a desert-like area, and they have a lot of forest fires. And it's very, very stressful, and it's very, very conservative. And Detlef has really experienced a lot of isolation. So, for example, in the urban areas where 70% of us are vaccinated, in his community, last he heard, it was 34%, right? So very different. He's struggled going into stores during the pandemic when it's stated that everyone must wear a mask, and not everybody does. And so during one of our calls, so you can imagine, I just want to say this, you can imagine that this past year was not just about the pandemic, right? So the pandemic was huge, but you know, where we live, we had major, major wildfires that caused a lot of devastation. And Black Lives Matter, right? I mean, there's a whole movement around racial injustice, right? So if you look at the toll that has taken, and guess what? We had a major divisive presidential election, right? Is that not enough to like make you just want to crawl under a rock? It was a very stressful time. So I'm going to tell you the story. On one of our Zoom calls, Detlef says something like this. You know what, guys? I'm not getting my HIV meds on time. That's never happened before. The post office, right? Things were slowing down. And he was not getting his meds in time. And he's part of Care Assist Oregon, where he gets his medications, I don't know, reduced or free or whatever, through a state program where he has to submit his documentation annually. So not only was his meds getting there late, his life-saving meds, but also he got a letter from the state, a sternly written letter saying, you haven't resubmitted your application and you're going to be cut off from the program. Well, he sent it in 2 weeks prior. The state hadn't received it. So he was really upset and really frustrated. And Jim, who I referenced earlier from the Portland metro area said, Detlef, that is wrong. You've got to write to your congressperson. This is crazy. This is what's happening right now. You should be getting your meds. He's like, I know, but I don't know what to do. So they connected offline, and Jim helped him write a letter to his congressman. And I have the audio of him reading the letter, which he basically says, I'm a 63-year-old long-term survivor and I need my meds or I'll die, and explains what's happening with the post office. And lo and behold, he heard back from his congressman and asked him to submit information. and said that they were doing an inquiry into the post office, thanked him. And also he switched his medication delivery from the post office to UPS. They have not been late since. Sorry he had to do that. And also he got support to get his thing on track with the state of Oregon, so his meds won't go interrupted. But that was hugely, like it was a huge problem. And it was wonderful to see the advocacy that emerged because of the connections. And I'll also say that these folks were strangers prior to the call, okay? And the same thing that happened with the, well, I'll call it the geezer group. So the Wednesday group, oh my goodness, I don't know how it is in Philadelphia, but older adults really felt like they were kicked to the curb because it was like, yes, we're prioritizing older adults, but then trying to get an appointment was really, really hard in the beginning. And so they started this text chain, like, because it was hard. You had to go, you know, like, does Safeway have it? Does Albertsons have it? Does CVS? And what they did is they supported each other. They'd say, quick, go to the Rite Aid. I just made my appointment. Do it now. And they did this and they support each other. And some people were very uncomfortable with getting a needle or afraid of reaction. And they drove each other and they took each other. And that's the kind of support that has come from this. So with that, I'm going to now open it up to Q&A. And I'm going to stop the share. I think it's probably a good time to stop the share. Let's do that. Okay. And I think someone's going to help me with the chat box.
Yeah. Thank you, Paul, for an awesome presentation.
Thank you. Thanks so much.
So, okay, so let's go over to the Q&A. So if there's anyone that is watching, if you have questions or comments you would like to share with Paul, feel free to put it in the Q&A box below. So we do have one question. I suppose this is probably right when you begin to share. The question is, are you saying faith people?
Faith, yes, faith-based. I was probably saying faith-based is what I was saying. Yeah.
Okay. So as I was listening to your presentation, I really my heart began to smile when I seen how you've created this community of supports. And especially the picture you showed behind, I guess, was it your home? When you gathered around, you had your reunion. So that was
home, yeah,
really,
yeah.
I think activities such as that can be really healing for folks, right? To be around folks, to have that sense of support in light of everything we've all experienced and have been exposed to. So yeah, thank you for having that space.
Yes, and you know, what was interesting is that Wednesday, every group is different, right? So the Tuesday group never got together. The Wednesday group, they're buddies. The HIV group, I'm going to tell you a story while we're waiting for some of the questions to come in. One of our participants had he was on hospice and he was going to have surgery to extend his life by maybe 3 to 5 years. And sadly, that surgery did not work and he passed away. And it was very hard for our group. And, you know, we like, you know, somebody passes and that's the person who was very close to the group. So like, what do you do? And so the agency that he was involved with had a Zoom memorial service. And it was really good for people to be able to attend that. One of them, who's very, very introverted and doesn't leave his home very much, said, like, I feel like I could do that from my home. I don't think if it was in person. And then the group decided that they wanted to have a potluck. And I hosted the potluck at my home. And Detlef, who's from Klamath Falls, who you saw his picture, we got to have him join us through FaceTime. So he got to be there with us, and it was a tribute to Christian, who had passed away. And so the group decided that Christian was a real foodie. So they were going to either do something that Christian really liked, or they would do something like Christian would just be aghast, like, oh no, you don't put that on top of that. So it was a chance for us to come together and to honor Christian, and also I think for us to give ourselves permission, because that was when things were starting to loosen up around getting together. And I think what's going to happen now is, actually it is going to happen. The group has decided to have brunch on one of our Sundays, and we're going to have brunch actually on July 4th. That's coming up soon. So I think it's a movement forward. It was very sad that we lost Christian. It was really hard. It's still hard. And also I think it propelled us forward in a different way.
Awesome. Thank you for sharing that. So if there's anyone with any questions or thoughts, please feel free to share. And so in light of, as you shared in your presentation about, what happened, just everything we've been exposed to and experience over the year and a half, all of us we were forced to pivot to learn Zoom and to learn how to use FaceTime to conduct business or just to keep a connection, right? So here we are, the world is opening back up. And you mentioned that you guys are having a brunch. How are you, what are some of the plans you have to move forward with the supports that you've been offering over the past year and a half to what's happening now?
It's an excellent question. Thank you for asking it. So first off, I just want to say that when I offered this last April, I didn't say, hey, Paul, we're going to offer this forever. Like that wasn't, and a lot of times like with nonprofits, you sign up to be a volunteer and there's an expectation like you'll do it forever. Mm-hmm. And so I didn't think of that. So I guess I just didn't think of it. So typically when you do things like this, it's like, we're going to do a 6-week workshop on whatever. We're going to do 8 weeks. Well, I didn't think of that. And so with the Wednesday cohort, I just had a conversation with them, I think it was around the end of the year, saying, hey, just want to check in, how are things going? And they're like, we have no plans unless like you say, like, forget it, I'm done. But they're like, this is really important because blah, 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 we really like this. And I said, okay. And just to play devil's advocate, things are going to be opening up. But really the messaging was, we like this and can we keep it? The other thing I'll say is there's a waiting list for each group. And both the HIV group and the Wednesday group, I said to the group, okay, so there's some people who are waiting. And like in the Wednesday group, somebody dropped out because she was taking a course. I said, do you want to open it up? And the reaction is like, if we have to, but you decide that as the facilitator, but we don't really want that because we have this trust. And if somebody comes in, we don't know, and we're probably not going to participate at the same level until we kind of know what they're like. So that was telling. And the other thing is, because of that issue, I've hired a researcher. She's a gerontologist, a researcher, and a colleague of mine. She's doing 2 focus groups this month, one with the HIV group and one with the Wednesday group. And we worked on questions together to find out, like, what do you think? And I'm here at a conference telling you what I think, but I'm like, I'd really like to have the voice of people who are part of this. Like, so she's asking very pointed questions and also saying like, would you start one now? And I think people like it. I mean, I think it's come to be that even if things open up, this has been a safe place. And the other thing, part of this is Hollywood Senior Center. Their director of programming reached out to me last week and said, hey, Paul, we're going to probably do a soft launch. And your group has been the longest. So we're reaching out to you first. What do you think about bringing your group to the senior center when we open? And you know what I said? No, not right now. And that's because it's respect for the group, where I don't see, because the senior center is very busy and it's hopping around, it's happening so fast. And I'm like, I don't want to do that because some people prefer meeting in person. And I have one older adult, she's 82. And she says to me, she didn't know Zoom before. She lives with her son, daughter-in-law, and 2 grandkids. The grandkids set her up on Zoom. She's like, I don't have to ask anybody for a ride. I have more independence than I've ever had before. Like, don't take my Zoom away from me. So there's that. And I was thinking of one other thing about Zoom, which kind of left my mind. But all that to say, I think people are still expecting it. And so I'm going to continue as long as the need is there. But I'm also curious from a research perspective, like, do we stop? Oh, I know what I was going to say. With the HIV group, we've had many conversations about this. So there was a sort of an informal brunch that happened every Saturday in person. That hasn't happened now for over a year. And what has happened is, and this probably happens in most of our social lives, it's like everyone's busy, right? So it's like you come there, it's sort of a potluck breakfast, and then people go. But we never ever got to get into like the depth of things. And now we have a full hour. So that's really, I think, with the HIV group especially, allowed us to say, okay, we're going to move past the niceties here and talk about stigma. We're going to unpack something. And I think people have been really hungry for that. So anyway, I'll stop there.
But that's awesome. I think what you're sharing, and it also exposes that the work that you've been doing has been impactful, and people seem to have been thriving because of it. Even though it's resumed, it served a purpose for folks during this time of COVID. And so, thank you for your work, and thank you for your dedication to help others. Again, I always think things like this in spaces, when we are able to hold spaces, is healing. It has a healing property that I think sometimes we may take for granted or even overlook. That is helping folks on a kind of a deeper emotional level. Like, wow, had this not been for you all, I don't know how I would have processed this experience of COVID or stayed in connection with another person. And so, thank you.
Thanks. Thank you. And I also think that this is prime for grant funding. I think that, with these variants that are coming out, and people are also reluctant, they may be okay in a small space or whatever, but I'm a fan of asking funders for money to fund this. And I didn't say this earlier, but the group that we started, the first cohort for the low-income older adults, that was absolutely amazing. And they're building a second cohort now. They got some new funding from HealthShare of Oregon. The original funding went away, but that was probably the most prideful of all for me, is to see these older adults on Zoom for the first time. And they didn't really need a lot of coaching, right? And it just really opened their worlds in a way that I was like, and we had money. We could buy them a tablet. We could buy them a Chromebook. We could pay for their Wi-Fi. And it really made it so easy. And then we had a person, like a resource person who was funded in the grant. She got people hooked up to Internet Essentials, which is through Comcast or Xfinity. And it's $9.95 a month for people on a fixed income. So people are able to sustain that now. Those groups are continuing. And so I'm really proud of that. And I would like to see more things. Detlef, the person who I mentioned from Southern Oregon, it took him 3 weeks. He was really frustrated because he didn't know how to log on to Zoom. And again, I was really nurturing that relationships and he didn't want to have people come into his home because of potential COVID stuff. But we were really supportive, and this is just like a huge lifeline for him. So that's something that I'm really passionate about, is how do we remove some of those barriers? I talked about barriers earlier. Sometimes they're geographic, but sometimes they're financial, sometimes they're systemic. So anyway.
Absolutely. So thank you again, Paul, for sharing and offering an awesome presentation for people to even take notes and consider how we can, how to maybe even kind of replicate some of your ideas to support other older folks in the community, even after COVID. I think that's something that we've all learned about this technology, right? After COVID, we would have become computer savvy, if you will.
It's kind of pushed us. Yeah. Yeah.
Someone says, thank you so much for a wonderful presentation.
Thank you. Great meeting you.
Okay. So if there isn't anything else, those who are still watching, please don't log off. When we end the presentation, you will be prompted to complete a survey. Again, we want to hear from you and all of your ideas and thoughts about today's presentation. Paul, have an awesome rest of your day. It's still early over there, right?
It is, yes, 9:30.
It's afternoon on our end. And so have an awesome day and the rest of your week.
Thank you. Thanks for having me. Take care.
Everyone. Bye.
Bye.